tell her she's a knitter, but she'll slap me. So she has some issues with her forearms and her hands. Most spinners, knitters, she tells me, will have problems with their wrists. When you have problems with something like that, and it's part of your income, something that you enjoy, maybe a musician, maybe you're on a computer constantly as a programmer, it can be really anxiety-inducing to feel like you're having a repetitive stress injury. And a lot of these issues are actually fairly easy to deal with if you catch it early. And even if you don't, it can be rehabilitated. It just takes time. A lot of people, I jokingly say, do not have carpal tunnel syndrome, in my opinion. They're simply having a problem with what we call their forearm extensors. These are the muscles on top of the forearm, if the palm is facing down. You have two bones, the radius and the ulna. And the musculature of the extensors goes right up towards the elbow. All fleshy. The radius and ulna are right beside each other. And the way that you can explore this is if you place palm pressure, just flat palm, down through this area. If you look very closely, you can start to see that Andrea's fingers will start to move. What I will usually do is place pressure and hold it, and then I'll have Andrea move her fingers, and then ask her if she can feel that. When I'm dealing with clients, the reason I do that is because I'm trying to make them aware of the area and what's causing the issue. A lot of times people think it's their hands, but it's often not just the hands. It's actually musculature nearby that's related. These forearm extensors go down and then insert. You get these little bands of tendon that go down into individual fingers. You can see mine. So when I'm using my forearms, all of these muscles are contracting. They're clamping down, and in some instances, with say like carpal tunnel syndrome, even the tissue between the radius and the ulna is squeezing together and causing some sort of nerve entrapment. Doesn't mean it's permanent, doesn't mean you necessarily need surgery. Always advise, talk with your doctor. But if I'm going to work on this, two of the primary things I'm going to do are what I just showed you, which is to apply a broad pressure. Her arm is gently bent, so it feels okay on her elbow. It allows the radius and the ulna to be side by side, so I'm not pressing the bones down and together. And I'm putting pressure here. You can use a slight bit of cream to have some glide. In this instance, we don't really need it. And what I'm doing is stripping that muscle. I'm treating it like a sponge where I'm squeezing out the blood and then allowing the blood to rush back in. Typically, you're going to move towards the heart, which is the direction we're moving. In addition, I will grab individual fingers, starting with the thumb. I'm going to gently traction the thumb and glide up a little bit closer to the radius. Then I'll move to the next finger. So I'm pulling on the attachment into that muscle and providing some space in between the joints in the carpals and the fingers. This should always feel good. It may feel intense, but it does not feel painful. You want to be able to put enough pressure so that it gets the person's focus, but not so much that it's just pain. Pain tells the body, the musculature, to contract, to protect itself, and that's what we don't want. You can do this as many times as you want. If you have a partner who can do this for you, it's very simple. It's just palm pressure primarily through the heel that I'm gliding up and through and here. And how does that feel?
It's intense.
But it feels good?
Yes. Good. I spent 4 hours spinning last night, so those muscles are very sore right now.
So as you can see, I can let go of the fingers. I'm still gliding along. You can do this several times. Each time you go through, the muscles typically, the superficial muscles will soften and start to let you in deeper and deeper. You can do this multiple times a day. It's going to allow your loved one to continue with their knitting and spinning. It's going to help force blood into that area to clean out, even on the cellular level, taking out waste products, providing more blood so the cells get oxygen and nutrients. Now, if they feel particularly stuck, I will again place their arm out. I will put pressure by leaning. And how's that? Is that enough? Okay. So I'll find out where I can lean that it feels firm. It feels like I'm contacting the muscle and the muscle is tight. Then I'm just going to hold it in place and I'm going to have her move her fingers again. She can move her wrist side to side. She can make a fist. She can spread her fingers out. She had a little bitty adjustment, sounded like in her wrist just from that. And then I'll take the pressure off. If you can see closely, her forearm has turned a little red, a little pinkish. That's just therapeutic inflammation. We've just forced blood into the area. That alone, those two things, a gentle strip through the area to force blood in, with a little bit of pressure and mobilizing the fingers can make a huge difference to someone who's having issues with their palms and hands. In my clinical experience, more people have issues with the forearm extensors, this side of the forearm, than they do the underside. It's not impossible to have issues here, but most of the repetitive stress issues that I see are actually coming from the opposite side. So even if someone is grabbing here and pressing on their own forearms, where they're going to get the most benefit is usually from this side of the forearm with the forearm extensors instead of over here. Whenever I'm putting pressure like this and gliding along, you are still getting some compression to the other side as well. But we're working on this side of the forearm, which is where the top of the palm is.